Right now, there are benefits sitting inside your Medicare plan that you are fully entitled to. You have already paid for them, and most people never use them. Not because they don't exist, not because they're hard to get, simply because nobody told them. Today, that changes. Most people know Medicare covers emergency care. Most people know it covers hospital stays. What most people don't realize is that original Medicare, Part B, covers something called the annual wellness visit. Every single year, at no cost to you, no copay, no deductible, nothing. This is different from a regular checkup, and that distinction matters more than you might think. During this visit, your doctor reviews your complete health history, updates your medical record, assesses your risk for cognitive decline, screens for depression, and creates a personalized prevention plan going forward. It's one of the most comprehensive health reviews Medicare offers. And according to data from CMS, the Centers for Medicare and Medicaid Services, fewer than 20% of eligible beneficiaries actually schedule this visit each year. Think about that. 8 out of 10 people who could walk into their doctor's office for a completely free, comprehensive health review don't. Some don't know it exists. Some confuse it with other appointments. Some assume there's a cost. There isn't. If you haven't scheduled your annual wellness visit this year, that's your first call tomorrow morning. Here's something worth knowing. Medicare Part B covers a long list of preventive screenings, many of them completely free for conditions that, if caught early, are highly treatable. Caught late, they become life-altering. We're talking about screenings for cardiovascular disease, diabetes, certain cancers, osteoporosis, depression, and more. Colorectal cancer screening, covered. Mammograms for women over 40, covered annually. Bone density scans for women at risk, covered. Abdominal aortic aneurysm screening for certain smokers, covered. Lung cancer screening for high-risk individuals, covered. These screenings exist because catching something early is the difference between a manageable condition and a medical crisis. And yet, many Medicare beneficiaries have never had a single conversation with their doctor about which of these screenings they qualify for. Not because their doctor doesn't care, but because in a busy 15-minute appointment, nobody brings it up. You have to ask. And now you know what to ask for. This next one is one of the most underused benefits in all of Medicare, and it's also one of the most important. Medicare covers mental health services, outpatient therapy, counseling, psychiatric evaluations, covered under Part B, typically at 80% after your deductible. Now here's why this matters far more than most people realize. Depression among older adults in America is significantly underdiagnosed. The National Institute on Aging has noted that many older adults either don't recognize the symptoms or feel reluctant to seek help because of stigma, because they assume it's just part of aging, or simply because they don't know Medicare covers it. It does, and in 2024, Medicare expanded telehealth access to mental health services, meaning you can now see a licensed therapist or counselor from your own home through a phone or tablet with no travel required. That's a major change, and most people don't know it happened. If you or someone you love has been carrying something quietly, anxiety, grief, the kind of loneliness that comes with retirement, loss, or just the weight of getting older, this benefit exists for exactly that reason. You don't have to carry it alone. Over 30% of Americans age 65 and older have diabetes, and tens of millions more are considered pre-diabetic, meaning they're at serious risk, without necessarily knowing it. Medicare has built significant coverage around this. If you have diabetes, Medicare covers diabetes self-management training, therapeutic shoes and inserts to prevent complications, and regular monitoring supplies depending on your plan. But here's the part most people miss. If you are pre-diabetic, not diabetic, but at risk, Medicare covers the National Diabetes Prevention Program. It's a structured lifestyle change program delivered by trained coaches designed to help you prevent type 2 diabetes before it develops. This program has shown in clinical studies to reduce the risk of developing type 2 diabetes by over 58% in high-risk adults. That is not a small number, and Medicare covers it. The question is whether your doctor has mentioned it, because if they haven't, you now know to bring it up yourself. Prescription drug costs are one of the biggest financial stressors for older Americans, and there is a Medicare program specifically designed to help, one that millions of eligible people have never applied for. It's called Extra Help, sometimes called the Low-Income Subsidy. This program helps cover the cost of prescription drugs under Medicare Part D, premiums, deductibles, and copays. For people who qualify, it can be worth thousands of dollars a year in savings. And here is what makes this genuinely surprising. The income and resource limits for Extra Help are higher than most people assume. Many people rule themselves out before they even check, assuming they earn too much or own too much to qualify. In many cases, they're wrong. According to the Social Security Administration, there are still millions of Americans who are eligible for this program right now and have never applied. If your prescription costs feel like a burden, or even if you're just not sure, it costs nothing to check your eligibility at ssa.gov or by calling Social Security directly. One phone call could change your financial picture significantly. So let's bring this together. Medicare is not just hospital coverage. It is not just a card you carry in your wallet. It is a system with layers: preventive care, mental health support, disease prevention, prescription assistance that most people never fully explore. The annual wellness visit, free, available every year. Preventive screenings for serious conditions, covered. Mental health and therapy, including telehealth from home, covered. Diabetes prevention and management programs, covered. Extra help for prescription drug costs, available to millions who haven't applied. None of this requires special connections. None of it requires fighting with insurance companies. It requires knowing these things exist and taking the simple steps to access them. The system doesn't always volunteer this information. Doctors are busy. Open enrollment periods come and go quickly. And frankly, nobody sends you a letter that says, "Here is everything you're missing." That's what this channel is for. Because the people who get the most out of Medicare aren't the ones with the most money or the best connections. They're the ones who know what to ask for. Now you do. If this was useful to you, share it with someone who needs it, a parent, a spouse, a friend who just turned 65. Because this information doesn't spread on its own. And if you want to understand more about how Medicare actually works, what it covers, what it doesn't, and how to make sure you're getting everything you're entitled to, there's more coming on this channel. We'll see you in the next one.